Oh, I like that. Frankie Valli and the Four Seasons. There you go. This is What She Said on Sirius XM Canada Talks. I'm Sharon Caddy with Christine Bentley and our guest, Dr. Nadia Kumentas. Before we get into some of these targeted things, I have one question, which... Does it matter whether you're washing your face with hot versus cold water or cool water or warm water? Does it make a difference?
It does. If you're washing your face with water that's too warm, it can be dehydrating if you're not moisturizing right away afterwards, and especially when we start talking about eczema.
Oh, but it feels good.
And if you want to steam and kind of do a treatment that way, that can be very good. It just depends on how quickly you're moisturizing afterwards.
Okay.
Yeah.
There you go.
So let's look at acne and some solutions. And you have your favorite zit zapper.
Yes, yes. I actually just did a blog post about this for Greenhouse Juices. I have discovered the ultimate zip zapper.
Okay.
Yeah.
Where were you when? Okay. Anyway.
Okay. Shall we start with acne first and then go to the zit zapper?
Sure, absolutely. Acne is a very, very, very popular topic. And actually, I had very acne-prone skin.
Me too.
Yeah, and it's devastating. It's very frustrating, especially if you pick. Picking is terrible. And so many acne sufferers are pickers as well, which kind of leads to hyperpigmentation, scarring, and spreading of the bacteria. So like we were saying before, acne is very, very, very well treated when you do internal things as well as topical things. So when we're breaking down internal things, we definitely want to go back to what we were talking about, diet and lifestyle. So sugars, refined sugars, and kind of what are we putting in our body, right? We also need to look at, is the acne hormonal based? And most of the time,
a lot of the time it is.
It is, absolutely. And most women will notice that they'll have a cyclical kind of form of acne, depending where they are in their cycle as well. So then, as a naturopath, I look at hormone regulating herbs. Okay, something like chaste tree is very, very fantastic for regulating your endocrine system and your estrogens and your progesterones, etc. So we look at hormone regulation as far as herbs and botanicals. We look at what are we eating in our diet. Are we getting enough zinc and selenium? Those are two very, very important nutrients for skin health. Actually, did you know that one Brazil nut will give you your day's dose of selenium?
But now I do, and that's kind of interesting.
And I like them.
Yeah, I love them too. And so I have one Brazil nut every day, and that's fantastic for skin health. And zinc as well. And then we are going back to our antioxidants and our vitamin C and our vitamin A and our vitamin E.
Cool.
So the other thing that we're looking at as lifestyle things, are we putting our dirty phones on our face, right?
I think we all do that.
Yeah. Are we rubbing it on our face? Are we washing our pillows regularly enough? Are we washing our face towels regularly enough? Acne itself is a combination of inflammation of the pore as well as an infection from a bacteria known as P. acnes or whatnot.
Okay.
Yeah, so it's a combination of the two that actually will give you your zit.
Now, let's zap that zit.
Yes, okay. So honestly, this is so simple, it's crazy. And so most zit zappers you see on the market are either a combination or single of benzoyl peroxide or a sulfur compound or a salicylic acid. Okay? And those, if you go to most traditional dermatologists, those are the products that they will give you for acne. They can be wildly effective, but they can also dry out the skin, and depending on what products they're in and what binders they're with, they can also not be as clean for your skin. So this zit zapper is literally 3 ingredients, super easy. Most people have them in their house already. It is just apple cider vinegar, fresh lemon juice, and a little bit of water. That's it. That's it.
We need to know the combination. Okay. Exactly.
If we're talking heavy duty, we're just doing 50-50 apple cider vinegar, lemon juice. And it has to be fresh lemon juice. Okay. So basically you're doing like a half a tablespoon, or not, you don't even need that much really. I usually eyeball it, but you're just making a very small amount that you can use a Q-tip and directly put it on the lesions that you need to clear up. How this works is there's something called alpha hydroxy acids, and that comes from the lemon, and that actually helps to exfoliate the skin, as well as acts as an antibacterial. Okay, so that helps to kill the infection. The apple cider vinegar also acts as an antibacterial, and something that a lot of people don't talk about is your skin's acid mantle. So naturally our skin sits at a more acidic level, so a lot of our more alkaline products that we're putting on our skin actually create an environment that bacteria really like. So we want to keep it at more of an acidic level. So this little spot treatment, I have yet to see it not work on a pimple.
Really?
In 3 days. 3 days.
I gotta share this with my daughters. They'll be all over this.
So how often you would take a Q-tip? How often would you dab it on?
As often as you want, and the more times you can put it on, the better. So, and I actually really encourage people to, when they're dipping the Q-tip and they're kind of lightly putting it on the lesion, spend some time on it. Rub it around. Let it really absorb into the area.
Okay.
We love this tip. We love this tip. Let's move on to something similar, and that is something that affects a lot of people, and I think is now starting to affect me, although never did before, eczema or eczema, depending on how you pronounce it. How should we deal with that from the inside out and out?
Eczema is, again, also a very, very common topic, especially in children, young children. Eczema is even more interesting to do from an internal perspective because it's about regulating your immune system. Yes, so when we say you're thinking, eczema and your immune system, they are directly related because it's actually known as it's kind of like a overreaction of the immune system that is actually causing eczema. So we look at things like healthy probiotics. We look at sensitivities. Food sensitivities is a huge one that actually causes a bit of allergic reaction within people and can manifest into eczema. So as a naturopath, when I see a patient or a child who's coming to me with eczema, that's the first place that I start. I look at sensitivities, what kind of products they're using on their skin. A lot of detergents can be very irritating, especially for people with eczema and babies with eczema. I look at that, and then I also look at what products they're putting on top of their skin. There's a lot of very, very nourishing herbs and salves that you can make, and one of the best is actually oat. So we all know Aveeno.
Yeah.
We do know Aveeno, and you know what, actually, and I usually tell people to make their own oat salves, but for those that don't have the time or kind of need a quick fix, there is a baby Aveeno product that can actually be pretty good. It's not the cleanest, but for people who need relief and are looking for something pretty quick, that can be pretty useful. But
now, why is it for me? It seems the eczema will flare up at the change of seasons.
Yeah.
Why is that?
So your skin's sensitive, right? And also, change of season also has an impact on your immune system.
Okay.
So it's kind of a combination of things.
That's frustrating.
Yeah, absolutely. And coming into winter, I mean, our skin is dying for moisture.
But is there a replacement for all the prescribed medications? My niece has had eczema her whole life, and she's had one prescription after another. I don't know if it helps or not. I don't know if it's worse, but you kind of don't want to be putting all that stuff on.
Yeah. So number one prescribed is often a topical corticosteroid, and basically what that does is it just suppresses the reaction of the immune system. So is that a long-term cure? Absolutely not. No. Absolutely not. That's just, and again, that's looking at it from one perspective, right? We're just looking at it as a topical. There's nothing that we're doing internally, and we always must be doing both with any skincare problem. And so again, then we're looking at diet and nutrition. Are we giving our bodies what we need to create collagen and moisturize our skin?
There you go.
Yeah.
And before we go, I want to make sure we touch on, I was told by a skincare professional I shouldn't be using anti-aging products on my skin. So what is a nice natural approach to anti-aging on topical on my skin?
Vitamin C.
Vitamin C.
Vitamin C. You can make your own vitamin C serum, and it will... If there's one thing I leave you guys with today, it's vitamin C. Okay. Yeah.
Okay, we need that recipe though.
Yeah, I can give it to you for sure, because most vitamin C creams that you see on store shelves they won't do anything because it oxidizes very, very quickly. So by the time that you actually get it to your house, most of the time the active ingredients don't even work anymore and they can actually cause damage.
So what's the recipe?
Well, this is a little bit more complicated. I'd have
Okay.
to probably write it down for
Okay.
you.
You know what? We'll put it on our website.
Yeah, absolutely.
There you go.
Absolutely. Vitamin C cream. That's it.
Mhm.
The fountain of youth. We found it,
We
Sharon.
found it.
We found it. Woohoo!
It's been a pleasure having you. We'll have to have you come back again. There's
Thank
so
you.
much
I'd
we can
love
talk
to.
about. Dr. Nadia Kumentas joining us today. It's all about your skin and looking good at every age. Thanks so much.
Thank you.
And stay with us. Lots more to come on What She Said on Canada Talks. And Kimothy Walker will be joining us on the other side of the break with a woman known as the Cracker Queen. Want to find out who she is? You have to stick around. We'll be right back.
Did you pause that in between her?